How to treat gastroenteritis. Stomach flu. Gastroenteritis, the common stomach flu, is a condition where the gastrointestinal tract is inflamed, usually as a result of contracting a viral infection. Non-bloody diarrhea, nausea, vomiting, abdominal cramps, mild fever around 100 degrees F, headache or dizziness, physical aching or tiredness. Easy treatments: lay down. Often laying down and/or curling into a fetal position can feel more comfortable when you are experiencing gastrointestinal pain. Soothe your stomach with ginger ale or peppermint tea. Peppermint reduces spasms in the stomach that lead to vomiting and soothes the overall digestive tract. If drinking ginger ale, make sure to choose a variety made with real ginger. Ginger has anti-inflammatory properties that soothe your stomach. You may also chop up fresh ginger and allow it to steep in hot water for about 10 minutes before drinking. Hydrate yourself. A common cause of gastroenteritis is dehydration. Make sure to intake 3 liters, 0.8 US gal, of water per day for men and 2.2 liters, 0.6 US gal, of water per day for women. Drink water enhanced with electrolytes such as Pedialyte, Gatorade, Powerade, or coconut water, especially if you are vomiting or experiencing diarrhea. This will help your body make up the vitamins and minerals it might have lost during that time. Take oral rehydration salts if you are prone to dehydration. These are available at your pharmacy and replace glucose and other essential minerals that you lose when you are dehydrated. Do not drink fruit juice or milk if you are experiencing gastroenteritis. The sugar in fruit juices and the dairy in milk can be upsetting to sensitive or allergic stomachs. Consult a medical professional if your dehydration does not improve or worsens. You may need to be started on a fluid for. Eat ice chips. Chop up ice in a plastic bag with a meat mallet or a hammer until it is in little chips. If you have an ice maker, simply set it to the chipped ice setting. Suck on small ice chips to rehydrate yourself and bring your temperature down if you are experiencing a fever. Avoid solid foods. While you are experiencing the worst symptoms of gastroenteritis such as vomiting, stop eating solid foods for a day or two. If you choose to stop eating solid foods, make sure you are still receiving the proper nourishment to allow your body to heal itself. Drink a product such as Ensure, which is rich in the vitamins, minerals, and electrolytes needed to nourish your body. When you resume eating solid foods, do so gradually. If you immediately rush back into consuming a hamburger, for instance, your body will likely be shocked and you will end up with an upset stomach. Start off with relatively bland foods such as crackers, toast, gelatin, bananas, rice and chicken. Intermediate treatments: try the Brat diet immediately after an episode. The Brat diet outlines a diet composed of bananas, rice, apples, and toast for up to 2 days following an experience of gastroenteritis. These 4 foods are rich in fiber and are very easy to digest. While is it not a sustainable diet for continued use, it is highly desirable following a bout of gastroenteritis. Common variations of the diet include adding yogurt and tea. Purchase an over-the-counter stomach aid. Certain indigestion medications may help with the symptoms of gastroenteritis. Some common medications include Pepcid, Maalox, and Pepto-Bismol. These medications will only truly help if you are experiencing indigestion, acid reflux, or excess gas, but they can help calm your stomach. Avoid taking pain medications, as these can further upset and damage your stomach lining. Be especially wary of taking medications that contain ibuprofen, which is known to be particularly hard on the stomach. Always be aware of any drug allergies that you have before taking medication, and only mix medications if the labels denote that doing so is appropriate for your symptoms. Consult a doctor or a nurse advice line if you are unsure about a certain medication. Wait it out. Ultimately, There is no real cure for gastroenteritis, but don't be discouraged, it will pass. Gastroenteritis usually passes through your system within 2 to 3 days, but can last for up to 10 days. If symptoms do not subside, consider consulting a medical professional. Time-consuming treatments: consult a doctor to obtain prescription medication. If none of the non-prescription medications or immediate home remedies are easing your symptoms, consider contacting a doctor and obtain prescription-strength medication. Commonly prescribed medications for reducing vomiting include Phenergan, prochlorperazine, compazine, and ondansetron, Zofran. They are often prescribed as suppositories or administered through and for to avoid the possibility of the patient vomiting the pills after taking them. To reduce diarrhea, your doctor may prescribe diphenoxylate and atropine, Lomotil, or loperamide, Imodium. Visit a medical professional if symptoms do not improve. Common symptoms of gastroenteritis can also be indicators of more serious gastrointestinal diseases. Common treatments for gastrointestinal disorders include antibiotics, steroids, and immunosuppressant medications. Accurate diagnosis is extremely important when treating gastrointestinal disorders. Be sure to visit a gastrointestinal doctor and undergo the appropriate testing in order to receive a proper diagnosis. Practice good hygiene. Use hand sanitizer often. Always wash your hands after going to the bathroom, visiting public spaces, before and after eating, and whenever deemed appropriate throughout the day. Be sure to wash any clothing items, bedding, and/or washable toys that come into contact with an infected individual to avoid spreading the virus. Clean kitchen and bathroom surfaces daily. Use a chlorine bleach-based cleaner to sterilize countertops in your home and avoid bacteria from spreading. Avoid touching your face throughout the day. Over the course of a day, the average person often comes into direct contact with bacteria and viruses that have the potential to cause sickness. Be sure to avoid touching your face, especially orifices such as your mouth, nose, eyes, and ears, as much as possible throughout the day. Be sure to wash your hands before touching your face if possible. Avoid undercooked and raw foods. These foods have a higher ability to spread the stomach flu virus. Meats are especially prone to carrying the virus. Consume undercooked and raw meats and other foods with extreme caution. Do not drink untreated water or unpasteurized milk when possible. Untreated or unpasteurized waters can carry illness-inducing bacteria and viruses. Only drink from sealed bottles and use bottled water to brush your teeth when you are traveling. Wash fruits and vegetables thoroughly before consuming to remove any outstanding bacteria from the outside of the produce.